Thank you for watching this video. What I'd like to do is spend a little time just talking about my philosophy about hip replacement. My PA and I have generated the frequently asked question handout, which covers a lot of topics, but I just want to address some of the major topics or questions that patients have when they come in. Mainly being, when is it time to have a hip replacement, or am I a candidate? And I tell patients that hip arthritis is different than other types of arthritis, especially compared to the knee, is that hip patients start to have one bad day after another, and the hip doesn't seem to rebound back. The pain in the groin or the side or the back of the hip is just getting worse and worse. You're not able to sleep at night. A lot of patients will describe that they have to lift up their leg to get in and out of the car. Other patients will describe it feels like they pulled a groin muscle and it just didn't get any better. So when you have pain that prevents you from standing, you look at your weekend and you start to budget how much time you're going to walk or spend on your feet. You're not able to do your normal activities, or you've had to give up sports or athletics. That's really the time to start considering a hip replacement, and especially if the anti-inflammatories or pain medications or injections that you've had have not worked and are no longer working. That's really the time to move forward and talk about surgery. We spend a lot of time kind of trying to answer some of the questions about pre-hospital, during the hospital. What I want to do is talk a little bit about the implant selection and the approach. I've been doing anterior hip replacements for about 11 years now. Started in 2017 when that technique just became available, and brought that technique to Phoenix. My partners and I have all jumped on that technique and have been performing the anterior approach now for 11 years. The reason why we do that is it's a muscle sparing approach. We're able to get in and out of the hip with doing less damage. That also leads to it being a more stable hip with less risk of dislocation, and this also leads to less pain. In the early phase, you're able to get up and get moving. Typically patients will stay overnight, one night in the hospital, and then go home and go through their recovery. We typically do not prescribe physical therapy for our patients. I've found that a lot of patients have gotten hurt, or they're doing so well they go to therapy and they pull a muscle or a groin muscle, or they get pushed too hard. So our philosophy has been to back off on physical therapy for the first 6 weeks. Occasionally some patients will still have some weakness at 6 weeks, and they'll benefit from physical therapy, and then we'll start that at that time. With regards to implant selection, the hips that I typically use, people ask me what implant do I use. The answer is I use the best implant for each patient, and that varies. Sometimes we will use an uncemented hip, and that's primarily what I use. And other patients who have thinner bones, who are older, will put in a cemented hip replacement. I have an example here of a typical hip that I'll put in that has a shell that's press fit that goes into the pelvis. It's lined with a plastic liner. Don't use metal on metal hip replacements. There's been some bad outcomes from those, and we've stayed away from those. And then generally we'll put a stem that's press fit that goes into the femur. And then on top of that, we'll either use a metal or a ceramic ball that goes and articulates, and that becomes the hip joint. The hip is held in place by all your ligaments, tendons, muscles, those structures, and that's what keeps it in the proper position and from dislocating. As time goes by, hips wear out eventually, and it's the piece of plastic in the middle, the polyethylene. That's what wears out, and these days we're looking at 30 to 35 year lasting hip replacement. So in general, it's typically a joint hip replacement for life. There are numerous other questions and other topics that we can cover when you come into the office, but hopefully that gives you just a little bit of an overview of when you think you might be a patient who's ready for hip replacement, why I use the anterior approach, and the type of implants that get used. Thank you for watching this video. If you have any further questions, please contact us at 602-631-3161, and we'll be happy to answer your questions.